what is narcissism? Or narcissistic personality disorder? And what is a narcissist? And how might this be relevant to one's health and the broader understanding of well-being? When we're born and we're babies, we're pretty much all narcissistic, because a narcissist is somebody who, in a way, just really lacks empathy, has a somewhat selfish perspective, and has an inability to seemingly care about what anybody else's needs are, what they might think. And as babies, we all are, because we don't really care that it's 2 o'clock in the morning and that you're tired. Right now, I've woken up and I'm scared and I need a cuddle, or actually I'm a bit bored and I'd like you to play with me. So we're all narcissistic in a way. And there's been in recent years a lot of talk about narcissists and toxic relationships and abusive relationships, and he's a narcissist, she's a narcissist, and it's a very derogatory term. Now, real narcissistic personality disorder, if you're living with it and partners with that, there can be very toxic relationships, and I'm not saying that there may not be a need to have compassion for people and victims of people abused by narcissists. But if we take a compassionate view to the patient and to the client of how that develops, there's a lot of evidence coming to suggest that narcissism is a result of trauma. And it's about whether that narcissistic trait evolves as we grow. And what should happen for most of us is, with good enough parenting, to quote Winnicott, the good enough parenting is what will allow us to evolve beyond that childhood inevitable narcissistic behavior. And so we will start to develop healthier attachment, start to get what we call individuation, and to separate apart from that other caregiver and realize our own identities, to learn about relating with others, and to go through the tussles of toddlerhood, where we get angry because our brother's taken and snatched our toy, and how we negotiate that without lashing out, and we can begin to see that they may have a different perspective and a different set of feelings to how we do. And this is how we evolve to become relating social creatures. Now, it's because of those early developmental stages that we evolve out of that early narcissism. If we have traumatic childhoods, inadequate parenting issues, shaming as a small child, etc., these things can cause us to fail to evolve, really. And I think that's the nuts and bolts. That's the nuts and bolts of narcissism and in adulthood. So it's a compassionate perspective that we should be able to maybe work with narcissists if they choose to want to look at it. But the problem with real deep inset narcissists is that they don't think they need to change. They don't think they've got a problem. And so that's one of the challenges, that they very, very rarely end up in therapy, because they think that they know better than the therapist, and they think that they're fine and everybody else is nuts, and everybody else has got it wrong. And so it's very hard to convince a narcissist, a really full narcissistic personality disorder individual, to ever go into therapy. I can remember actually, in my own therapeutic journey and my own healing journey, I began to look at these elements of narcissism and kind of question myself. And I remember saying to a therapist, I said, do you think I've got some kind of, I've been wondering if I've got some kind of narcissistic traits? And she went, well, no, I'll tell you haven't. I said, how do you know that? And she said, because you've asked the question. And she said, a narcissist would never do that. And so if one is to be reflective or to be curious about oneself, then, you're not got those embedded narcissistic traits. It's in the cluster C category, along with things like borderline personality disorder. Famously don't like labels. Borderline personality is subtly different. And what we do know, sadly, about borderline is that there's nearly always immense abandonment issues as a little one. And so for all of the challenging behaviours for those people, narcissists, borderlines, there's a really compassionate perspective that they are that way because probably of their very early traumatic experiences.